Hey there. First, I want to thank you for the class this weekend.
Yeah, it was nice, huh?
It sure was.
Yeah. Like we definitely went deep on those elementals.
Yeah. My
Good,
question
good.
for you is, late December, I had that cardiac procedure. So almost 4 months
Right.
ago now.
The ablation?
Well, they couldn't do the ablation, but my question is the site at the left groin where they inserted the catheter,
Oh, yes, 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 yes. I was thinking of somebody else. Okay, gotcha.
it's still tender. Um, and the EP thought maybe it had to do with a nerve issue.
Could be. Yeah.
I mean, there was no bruising, but it's still tender in that area.
And there's no like little lump or swelling or something.
Nope, there was never any bruising, swelling.
Try putting
The,
just like a couple of drops of helichrysum on your fingers and just like rub it into that spot like several nights in a row. And then if that doesn't work, the next thing I go through, boy, tonight is sage night. I would try some sage, like, sage or even vetiver. Like I'd start with helichrysum and then next one, either sage or vetiver to like just calm down that nerve.
so helichrysum first, and
I
then
would, I
a
would
few
start with
days.
helichrysum. I mean, the other one that I would probably throw in the mix, if those didn't start bringing you relief within an application or two, is galbanum. I would throw some of that at it. Like it's sometimes when they pierce the skin and they go in, it's like close to a nerve or it hits a nerve or they cause a little inflammation or something like that happens. And as long as there's no like big lump or hematoma or anything like that, it's usually just a nerve got irritated or maybe got poked a little bit and it just needs a little bit of time to heal. Sage is very neuroprotective. It calms down the nerve. Vetiver calms down the nerve, stimulates some lymphatic movement in the area. But the helichrysum, if there is any sort of scar tissue or still something that needs to be fleshed out lymphatically, the helichrysum will do it. And if there's if you think of it in the idea of like a little bit of scar tissue, it could be like a little fascial lesion in there that is like wrapped around a nerve and keeps that nerve like irritated. And so even if you rest it for another 6 months, it still might just be the same because it's constantly wrapped around that nerve. Then the helichrysum will unwind that. So between all of that, one of those should get it.
So each of those are topical and try one for 3 or 4 days
Yeah,
in
I would
succession.
exactly. Yeah.
And does this have any bearing on doing a repeat procedure? Because we're talking about trying this again.
It wouldn't for me. Like I would say, unwind it just because there's some discomfort there, but I suspect that either it's a little fascial lesion or they got close to a nerve.
Okay.
You have it 10 more times and it probably wouldn't happen. It's like even when you get a shot, there's always a chance that you might hit a nerve or, there's areas in the body where it's less likely, but there's always that issue. And then there's always the issue that you might have a hematoma or something like that. And, it's most times it doesn't, but there's always the risk. Yeah.
I actually meant more the integrity of the vein itself that was punctured.
Is there a big concern about the integrity of the vein?
It's just a question. I don't know that there is.
You're probably fine. Yeah. I mean, if you are a little bit concerned about the integrity of the vein, take quercetin just to be sure. Like the quercetin will firm up the vessel walls, but it's probably not that big of an issue.
Okay. Thank
Yeah.
you so much.
You're so welcome.